and welcome to another episode of Boombastic Health in the Wild out here at the Health 2025 conference in Vegas. I am here with Fawad, who is the founder and CEO of Penguin AI. Thanks for being here.
Thank you for having me.
So I've been in this healthcare tech world and data world for a long time. And for me, I've kind of learned through the school of hard knocks. I spent a very brief stint at Ernst & Young doing consulting and then kind of launched out, and I had all this hubris and belief that I could transform healthcare. I think you've taken a much smarter path, which is going in and running data for some amazing companies that are household names. Why don't you just tell us a little bit about that journey? Then we'll get on to the real main event here, which is Penguin.
Well, thank you. So thank you for having me. Yes, as you mentioned, I feel fortunate. I feel very lucky to have had the opportunity to work at places like Optum as their chief data officer, at United Healthcare as their chief data and analytics officer, at Kaiser Permanente as their chief data officer. So I just was, I think, just lucky at a time where data was taking off and had the opportunity and go and spend time in organizing, understanding, cleaning, refining, supplying healthcare data across the ecosystem. And there's been, as you can imagine, there's a lot to learn on that journey. And I think part of the reason why I started Penguin is because some of those learnings needed to be transformed into ideas and products, and that's what we do.
Awesome. And so we were just talking a little bit as well earlier about Penguin and the name Penguin, which, you know, your lapel pin there is pretty cool. Very catchy. It takes a second. You're like, oh, I see. That's a penguin.
It's designed to confuse you for about 2 seconds, like, so you tune in.
Oh, right. So tell us about the name. That's cool.
Look, you know, when we were doing the names, we had a lot of marketing people giving us a lot of sorts of ideas. And, you know, somebody's like cognitive X, and I'm like, dude, what does that mean? Like, none of this stuff means anything. So I just like fruit names and animal names. You know, like Apple is a silly name, but it does the job. So Penguin, that was one reason. The second is I actually love penguins for some of the characteristics they display. So they operate in the harshest environment on the planet, right?
Right, true.
But to survive, they really have to work in groups, and they're very loyal to each other, so they form bonds that last for a really long time. And I think it's just sort of, when I think about healthcare, what it's going to take people that can survive in the harsh environment of change management in healthcare.
Right.
It's going to require group effort and team effort, and you got to commit to your customers, just like they have to commit to you. So we thought it was emblematic.
Awesome. Well, I like it. It's catchy. It's memorable.
Thank you.
And it's also one that you could probably get the domain name.
Yeah, I do.
So,
although you'd be surprised
how.
how.
Penguin.ai?
No,
Penguin something.
When I first went and looked at Penguin.ai, it was available, and I was on GoDaddy, I think it was, and I should have bought it, and I stepped away, got up, made a coffee, came back, tried to buy it, and it said it's been taken. And then they tried to sell it to me for $80,000.
Yeah, you know what's going on.
I know
they
exactly.
Can see who searches for what.
So I should have just bought it in the second I found it.
Crazy. It's
crazy. But here we are.
No, I like the animal thing too. I know for our portfolio company HC1, which we're in the HC1 booth here, we have a little dog called Casey.
Oh yeah.
And it stands for curious, accountable, collaborative, and ethical.
I like it.
It's easy to remember the culture.
And you have to understand people love the swag.
Right.
Like the penguin pens
swag.
we have, the penguin lapels we have. We have a couple of people that were customers, their moms, and their kids love penguins. So I swear to God, I have pictures of moms showing that their kid loves this little lapel thing and wears it to school every day.
It's like a toy, you know.
It's I mean, we just like to have fun.
Okay, so we have the background. You can hear that you're this rock star data guy. You roll up, you're like, I'm going to solve this problem. The core problem is what?
So there are a couple of core problems. Number one is that the amount of administrative work that happens to deliver healthcare in this country is very large. To put it in context, We spend about $5 trillion a year on healthcare overall. About $1 trillion plus is spent on administration. And these are things like prior authorization, risk adjustment, claims management, payments, fraud, waste, and abuse, just basic things, or on the front office, registration, scheduling. So these are problems that are taking $1 trillion+ out of our system. And just to put it in context, right? And you're like, well, $1 trillion here, that's not that big of a deal. We spend $800 billion total on all drugs that we consume in this country. So if we had admin days waste go down by 80%, drugs would technically be free.
Well, and on that note, if we actually had people on the drugs that were actually the right drugs that benefit them,
correct,
that 800 billion would drive so much of the downstream medical costs.
Well, that's part of the data problem, right?
Right.
That's part of the data problem and the information problem that we have.
And so there's this emerging world of GPT, which nobody knows what that stands for. It's so funny because everybody uses ChatGPT now, right? And go into any talk and say to the room, raise your hand if you know what GPT stands for. Not a single person will know that it stands for Generative Pre-trained Transformer.
Yep.
And even if they did know, they wouldn't know what that meant. Well, what it really means is it's based on it's going to spit out what's the data that's fed to it. And it always sounds sure, but it's not always right.
It's like a very smart parrot.
It is like a very smart parrot. Yeah,
when it talks, it sounds like you're talking to a human.
Yeah, it sure sounds.
But it's a
right.
parrot.
Yeah,
like that's the problem here, right? Is that
right.
So we used to talk about Dr. Google. Everybody would take their symptoms to Google and be like, "What does this mean?"
Right.
Now we have Dr. GPT.
Right. Exactly.
Right.
Yeah.
But the difference is that Dr. Google, you could tell, was a bumbling doctor that didn't really know the answers.
Right.
Was trying to stumble. But Dr. GPT acts like it is a real doctor. You almost believe it's a
Right.
real doctor.
It feels like it. You can ask follow-up.
Yes, exactly.
It responds in context. You're like, okay, I got it solved.
Yeah, well, so while there's plenty of uses for it for just symptoms checking and so forth, I think it gets complicated when people become dependent.
Right. So you just announced some big things out of your company, right? Some Series A funding, some big partnerships. You want to talk about that?
Yeah, we just announced about a month and a half ago that we raised a Series A round. We hadn't really announced any round. We raised a little bit of money at seed and then Series A. Collectively, we raised about $29.7 million. That gives us enough room and capital to accelerate the building and the hiring that's necessary.
Right.
We're seeing big adoption from our customer base, and we're seeing product market fit in a way that requires us to build the foundations further, so we're going to do that. The other thing that's very exciting, money is always exciting when you're a startup, but the thing that I'm very excited about is this partnership we've done with University of Pittsburgh Medical Center, UPMC. They have a division called UPMC Enterprises. It's a VC firm underneath UPMC. It does also some incubation. And they've also built this thing called a data platform, a hobby data platform. And what they've done is that they've collected this longitudinal data about patients. They brought it all together into one platform. They de-identified it. And now very selectively, they're making it available to partners to be able to use it for research and development. And we signed this partnership because we want to use this data to build smarter, more intelligent models, right? So as we were saying, you can have Dr. GPT, which kind of looks like a doctor, but is acting like a doctor.
Right.
We want to build better doctors. We want to build better nurses. We want to build better PAs. And that's going to require not Reddit data, not Google search data. That's going to require longitudinal, high quality, clean records. And that's what we're partnering with UPMC Enterprises with and the Hobby team. And I'm just super excited about the outcome of the models and the accuracy that improves, and then how we can deliver that to our customers.
That's so awesome. Well, congratulations on those milestones. It is not easy to get to that point, and going from 0 to 1. But you're making it happen.
Well, look, I'll tell you, a lot of my friends and family were worried when I told them I was doing a startup, because I'd lived in big company land for a long, long time. I'd had the big titles, I had the big teams that had the big budgets, and it's scary for us to leave that comfort zone, the place where you're recognized and go into an arena where you got to be competitive, just like the other people that are coming out of Stanford or any other idea and competing. So I bring this up and I say this because I actually think if we really want to transform healthcare long term, we're going to need operators to come out and be founders.
Right.
And while it's a scary journey, you sacrifice a lot. You sacrifice benefits and salaries and all the other perks that come with executive roles. But there's a satisfaction in really knowing the problem and then trying to solve it after you've seen it on the inside. And I think I wish more people would do that. I would encourage other people to do it.
Just realize that the amount of persistence that's required is maybe beyond what you thought you could do in the past.
100%. And if you have a partner or a spouse, make sure you get clearance first.
Right. Oh,
yeah,
sure.
Because it's a lot on your family.
Yeah,
it's a lot on them,
Right.
because your world's going to shift, so is theirs.
Right. So you use this example of Snowflake as a widely understood underlying data repository, cloud type technology. And you talked about Penguin being sort of like that type of a concept, but specific for healthcare data and AI, and where you're enabling people to have their models running on top of your platform.
Yeah.
Could you give an example of what that looks like?
Look, so we sell it we kind of allow people, we meet people where they are. And a lot of healthcare entities are at different places in the journey. Some are further along, some are super early. And so what we provide is, at the simplest point, we provide pre-built agents for common tasks that are of administrative nature. So on the provider side, it could be a lot of the revenue cycle management capabilities, medical coding, claim scrubbing.
Okay, so it is actually a solution with certain set tools.
So we provide that out of the box.
Okay.
Right? So that's one thing. And there are plenty of customers that are just only looking for that. But then there's a little more customer that's a little more mature. And what they're looking for is uniqueness. They want to be able to connect to their data. They want to be able to refine these models that we have on the platform and make them even better. They want to customize the agents a little bit and integrate it into a slightly different workflow. So our platform starts to shine there and provides that capability. And then there's the rare today, but not so rare in about a year from now customer, where they need an AI solution because they need to build 20, 30, 50, 1,000 agents. And they can't do best of breed. So, and they don't want to go and buy AWS and buy the generic tools and then try to teach it healthcare. So what they need is an AI first healthcare platform on top of which they can deploy 50, 100, 1,000 agents. And that's the other customer for us as well.
So is it what's the specific entity? Is a health system a good customer? Is a health plan?
Yeah, so payers and providers are both customers for us. I don't believe that there's a separation between payers and providers. I think that's a segmentation some analysts did a long time ago, and we've stuck with it. The reality is processes start either on the payer side, end up on the provider side, start on the provider side, end up on the payer side. So what's the difference? So we focus on both sides. We focus on a process and we run it through all the way. If it's prior auth, we start with where the provider is, where they're submitting it, giving them insights at that level to make sure that they're submitting the right request. And then we follow it all the way to the payer side, where they're about to adjudicate it, making sure that they apply the right guidelines and that they're able to adjudicate and then evidence that they made the right decision. So we follow processes across.
So this could be an interesting platform for a risk-based, value-based care kind of
organization. 100%.
Well, okay.
100%.
Yeah, that's interesting. Well, I love what you're building. It sounds like you're onto something really big. I can tell that you're very enthusiastic, which is huge. As the founder, you got to have that passion, that energy. I like the Bezos day one mentality. Like every day you got to get up and be just as excited like it was the first day. And I think it sounds like you guys are going to go far.
Well, we hope so. We've got great investors. We have great partners like UPMC, and now we have great customers, and really we're just excited.
So great meeting you. Thanks for being on Boombastic Health.